Rob, are there any other benefits outside of using Strata for delayed discharges?
Well, I think that's where we've cut our teeth, the delayed discharges. In the Strata pathways, obviously we've got lots of pathways and Strata is going to be applicable to all of them really. One of the really exciting ones, if I can just talk about that for a second, is we're trying to pull in our general practitioners or GPs into our locality groups that we've got. So we've got multidisciplinary teams now operating in localities. And what GPs always struggle with, they've got very short consultation time with a patient coming in, and quite often they can't provide what it is they actually need. And sometimes it's not medication and it's not a particular procedure or anything else. It's a referral into another agency or another service. Sometimes it's just like social prescribing. So, we'll take you to a dance club or we'll get you involved with a walking club or a book club or something else. And they're trying to deal with mental health, for instance. They need something that they can refer on. The Strata is ideal for that. So you can have all of those different services, different outlets, all logged within Strata. And they've described it to me as like a red button. So when they get somebody coming in with, early onset of mental health issues or something like that, which is destroying their lives, but it's not medication, which is what they tend to turn to just now because they haven't got any other option. Here we have a big red button that we can put on the desk, which would be Strata. You press that button and up will come our access to, we've just introduced a new mental health service called Renew in the Scottish Borders. And this could become our way in. So, well, there's a gap in Jedburgh. And we know you live close to Jedburgh, let's go there. It's on a Monday. We'll book you in there. We know we've got that. Strata will tell us how you're getting on within because we'll get reports back. Now, at the moment, that's down to the GP knowing that's there in the first place, knowing they've got capacity there, having to pick up the phone, having to make the notes, having to follow through with it. This all makes it really simple and doable and achievable. So that's where we're really excited about it. So we haven't quite cracked the delayed discharges. There's lots of issues in there. We've made it a hell of a lot easier and we've got a grip of it now. What we want is the other pathways now that we can move into. And those are really exciting because I think we'll get an even bigger gain from there. We've hit one of our wicked issues. We've got many other wicked issues that we're going to have to move on to. And Strata's the tool that we're going to use.